The recommendation for treating a positive test result, either with fecal flotation or with fecal antigen testing, depends to a large degree on what particular parasite or pathogen one is talking about. Certainly in general, one should be treating hookworms and roundworms and whipworms whenever seen on a routine basis. What's more controversial, however, is the treatment of Giardia in our canine and feline patients. And the reason why this is so controversial is because one can divide these infected patients into symptomatic versus asymptomatic animals. There is no consensus amongst experts with CAPC in the US or the European scientific group who are also focusing on companion animal parasite control, that's SCAP, vis-a-vis the treatment of Giardia in asymptomatic animals. Most people would agree that a positively infected dog that is asymptomatic should either be left alone and closely monitored with owner education and advice about the potential zoonotic nature of this parasite and determination of risk factors that might have precipitated the animal from becoming infected in the first place. And so I think the best term that I would use is to simply try and optimize our treatment based upon the individual. This is not a shotgun approach. We were simply saying if a patient is asymptomatic, we should always be doing X or Y. That's not the case. If I have a perfectly healthy adult animal that has no inherent risk factors, that does not have any young kids or geriatric people in the household or individuals who are immunocompromised, that owner of the animal should be educated about the potential nature of that Giardia infection, and one can then determine to either monitor the patient closely without any treatment whatsoever, or if one is going to treat, the current recommendation is a single treatment of appropriate dose and duration without any additional follow-up and or treatment, even if the patient is still positive after that first treatment in the animal. One important question for consideration would be the apparently healthy adult dog that is asymptomatic, that is diagnosed with Giardia as an incidental finding upon its yearly exam, and that same animal is due for its vaccine boosters. And one could argue and say, should one vaccinate a healthy dog that is infected with Giardia? And there's no consensus on what is the appropriate strategy to procure in that situation. But from a personal standpoint, recognizing that the Giardia will be self-limiting in almost all of these healthy adults, I would elect to wait for that Giardia to be eradicated before moving forward with the vaccine in that particular situation.